Dyshidrotic eczema, also known as dyshidrosis or pompholyx, is a type of eczema that affects the skin on the palms of the hands, the sides of the fingers, and the soles of the feet. It is characterized by small, fluid-filled blisters that develop on the skin, causing itching and sometimes pain. In this video, we will introduce dyshidrotic eczema on fingers overview, causes, symptoms, diagnosis, complications, treatment options and home remedies. By the way, welcome to our channel. Don't forget to thumb up and subscribe. Signs and symptoms of dyshidrotic eczema on fingers. Dyshidrotic eczema on the fingers typically presents with the following signs and symptoms. Small, fluid-filled blisters. These are typically the hallmark symptom of dyshidrotic eczema. Itching. Itching is a common symptom of dyshidrotic eczema and can be severe. Redness and scaling. As the blisters begin to heal, the affected area may become red and scaly. Pain. In some cases, the blisters can be painful, especially if they become large or if they appear on the soles of the feet where pressure is applied. Recurrence. Dyshidrotic eczema may recur periodically, with flare-ups occurring every few weeks or months. It is important to note that these symptoms may also be present in other types of eczema, so it is important to consult a healthcare professional for proper diagnosis and treatment. Dyshidrotic eczema on fingers causes. The exact cause of dyshidrotic eczema is not fully understood, but it is believed to be related to a combination of factors, including allergies. Some people may develop dyshidrotic eczema as a result of exposure to allergens such as nickel, cobalt, or chromium. Irritants. Certain substances, such as detergents, solvents, or chemicals, can irritate the skin and trigger the development of dyshidrotic eczema. Stress. Stress can weaken the immune system and make the skin more susceptible to developing eczema. Sweating. Excessive sweating can cause the skin to become moist and irritated, which can trigger the development of dyshidrotic eczema. Genetic factors. Some people may have a genetic predisposition to developing dyshidrotic eczema, although more research is needed to fully understand this connection. Age. Dyshidrotic eczema is more common in adults between the ages of 20 and 40, although it can occur at any age. Gender. Women are more likely than men to develop dyshidrotic eczema. Atopic dermatitis. People with a history of atopic dermatitis, a type of eczema that typically begins in childhood and causes dry, itchy skin, are more likely to develop dyshidrotic eczema. Certain occupations. Jobs that require frequent exposure to irritants, such as cleaning or healthcare work, may increase the risk of developing dyshidrotic eczema. Climate. Exposure to hot and humid weather or cold and dry weather may trigger dyshidrotic eczema in some people. How to diagnose dyshidrotic eczema on fingers. The diagnosis of dyshidrotic eczema on the fingers is typically based on a physical examination and a review of the individual's medical history. In some cases, a doctor may order additional tests to rule out other conditions or to confirm the diagnosis. During the physical examination, the doctor will look for characteristic symptoms of dyshidrotic eczema, such as small, fluid-filled blisters on the fingers or palms that may be itchy or painful. The doctor may also look for signs of skin irritation or inflammation. If the diagnosis is uncertain or there is a possibility of an underlying condition, the doctor may order tests, such as a skin biopsy or patch testing, to help confirm the diagnosis or rule out other conditions. In some cases, a doctor may also refer the individual to a dermatologist, a specialist in skin conditions, for further evaluation and treatment. Treatment options of dyshidrotic eczema on fingers. The treatment of dyshidrotic eczema on the fingers typically involves a combination of self-care measures and medical treatment. The following are some treatment options. Topical corticosteroids. Creams or ointments containing corticosteroids can help reduce inflammation and itching associated with dyshidrotic eczema. Topical calcineurin inhibitors, such as tacrolimus and pimecrolimus, may also be used to reduce inflammation. Moisturizers. Regular use of moisturizers can help keep the skin hydrated and prevent dryness, which can trigger flare-ups of dyshidrotic eczema. Soak and seal. Soaking the affected fingers in cool water for 10 to 15 minutes, followed by applying a moisturizing cream or ointment, and then covering with cotton gloves can be helpful in reducing symptoms. Oral medications. In severe cases, a doctor may prescribe oral medications, such as prednisone, to help reduce inflammation. Allergy testing. In some cases, allergy testing may be recommended to identify and avoid triggers that can cause flare-ups. It is important to work with a doctor or dermatologist to develop an individualized treatment plan that is tailored to the individual's specific needs and circumstances. Dyshidrotic eczema on fingers. Home remedies. While there is no cure for dyshidrotic eczema, there are several home remedies that can help relieve symptoms and prevent flare-ups. Keep the affected areas clean and dry. Washing the affected fingers with lukewarm water and mild soap, then drying them thoroughly, can help prevent infection and reduce irritation. Apply cool compresses. Applying a cool, damp cloth to the affected fingers for 15 to 20 minutes at a time can help reduce itching and inflammation. Use moisturizers. Regularly applying a fragrance-free moisturizer to the affected fingers can help keep the skin hydrated and prevent dryness, which can trigger flare-ups. Soak and seal. Soaking the affected fingers in cool water for 10 to 15 minutes, followed by applying a moisturizing cream or ointment, and then covering with cotton gloves can be helpful in reducing symptoms. Avoid irritants. Avoiding exposure to irritants, such as soaps, detergents, and solvents, can help prevent flare-ups of dyshidrotic eczema. Wear gloves. Wearing gloves when working with water, irritants, or allergens can help protect the skin and prevent flare-ups. Stress management. Managing stress through techniques such as meditation, yoga, or deep breathing exercises can help reduce the likelihood of flare-ups. Be mindful of diet. While there is no direct evidence that diet can trigger dyshidrotic eczema, some people find that avoiding certain foods, such as gluten, dairy, and eggs, can help reduce symptoms. Keep nails trimmed. Keeping nails trimmed can help prevent scratching, which can exacerbate symptoms and lead to infection. Avoid extreme temperatures. Exposure to extreme temperatures, such as hot water or cold weather, can trigger flare-ups of dyshidrotic eczema. Try to avoid extreme temperatures as much as possible. Thanks for watching. Take care and stay safe.